Welcome to Pajan Imaging Hub. In today on how to do series on radiographers, other health professionals, education series, we'll look at right and left ventricular enlargement. Please don't forget to like, share, and subscribe to this channel so that you'll be notified when new video is released. Welcome back. In right ventricular enlargement, the following are some of the signs you should look out for. Increase the convexity of left upper cardiac contour, an uplifted cardiac apex, a filling of the retrosternal space in lateral film. We will look at some images to see how we identify these features in chest X-ray. Well, let's look at what we should look out for in case of a left ventricular enlargement. The left heart border is displaced leftward, inferiorly and posteriorly. Then we'll look out for Hoffman regular sign in lateral X-ray. Then look out for Shimo sign in PHS X-ray. Let's take a little time and look at the anatomy we see in lateral chest X-ray to be able to appreciate when we look at lateral chest X-ray, to see the structure that we're expected to see. This is the left ventricle. This is the right ventricular outflow tract. This is the left atrium. Then you see the aorta, the descending aorta, the IVC is there. So you see the SVC up there. Let's take a look at some of the radiograph. We'll talk about raising of the apex of the heart in the case of right ventricular enlargement. So this is the case here. You can see this one too is raised. So it helps us appreciate right ventricular enlargement. Then we'll talk about filling of the retrosternal space. You see the whole retrosternal space is here. But there is something here in case of X-ray with a lesser degree of enlargement. There is rule. You measure from the manubrosternal junction around here. This is the manubrosternal junction. You measure from here to the diaphragm. Then the filling of the retrosternal space, the level occupied by the filling should be greater than 1/3 of this length you've measured. But in this case, the filling is much compared to this is more than 1/3. And we'll talk about raising of the left upper border of the heart. So you see here, it increases in convexity. So, when we listed the feature under left ventricular enlargement, we'll talk about Shimo sign. This Shimo, this structure is Shimo. So think of picturing it inside here. In this image, we look at Hoffman sign, Hoffman regular sign. We'll draw a straight line from where the IVC made the diaphragm. Then at 2 cm from the junction of the IVC and the diaphragm up, we'll draw a line to meet the posterior border of the left ventricular wall. If this line between this vertical line and the posterior border of the left ventricular wall is more than 1.9 cm, then it is a sign that implies that there is a left ventricular enlargement. Thank you. Please share and subscribe to this channel. Bye for now.